Okay, welcome back. Speaking of flexibility, thank you all for being so flexible and helping me respond to that. Um, all right, so let's keep it going. And I'll share my screen with you all again, and let's try this again. Let's see. Here we go. Okay, from the beginning. Okay, cool. Um, okay, so we were going over inflexibilities. All right, so this question here. So if I experience psychological inflexibility, does that mean I have a mental health disorder? No, not necessarily. What tends to happen though is that if someone is experiencing enough psychological inflexibilities, then yes, the chances are then they could eventually then qualify for a mental health disorder. And just because you might have some challenging inflexibilities that you're experiencing or that you're noticing, it doesn't mean that one that you have a mental health disorder. Um, or it also doesn't mean that you can't necessarily get support with that either from a therapist. And so for whatever it's worth, if a therapist is primarily practicing from acceptance and commitment therapy, um, treatment can be anywhere from 10 to 12 sessions in length, or it can be longer. It really just depends, but something just to be aware of. All right. So flexibility is really like the opposite of what we were just talking about. So we have acceptance, diffusion, flexible attention to the now, flexible perspective taking, values, committed action. So acceptance, I'll go a little bit more into that here in the next slide or two. Um, so we'll go into that in just a minute. Diffusion, there's some diffusion techniques that I'll show you here at the end. Some things that you could do to potentially increase your flexibility. Um, And then the attention to now, this act incorporates a lot of use of mindfulness. So observing your experience rather than evaluating it or judging your thoughts, your feelings, your sensations, all within the present moment. Flexible perspective taking, essentially being mindful of not getting overly attached to, like I said, like an identity, a story, a trauma. So being able to separate yourself from time, place, or thing. Values. I'll talk a little bit about values here, but values, it's what you do. And committed action is a larger pattern of how you're going to live a value-based life. Um, so these are the flexibilities that a therapist or an ACT therapist might then try to support you in increasing. Um, and so for all the therapists out there, yeah, like I have this slide here because sometimes a therapist can get really comfortable with maybe it's their act conceptualization, but I want to highlight that to be careful of being too acty. Sometimes people just don't completely resonate with like some act skills. But that doesn't mean like an act, like everything has to be 100% act all the time. If you're doing that, chances are, um, you're not being flexible with your approach. So just something to be mindful about. And even with an ACT therapist, they can use other techniques such as CBT or DBT, and that's something I do with my clients all the time. So acceptance, it's a big piece, I should say, of an act, hence the term acceptance in commitment therapy. So I like to just explain this practice or concept with the notion of pain versus suffering. So, so pain versus suffering, I have some examples. Maybe just because of what we had gone through here moments ago, I'll go with like an example here at the bottom of like what pain versus suffering is. So, um, pain is like, oh, I'm feeling worried about this presentation. I'm feeling worried about this presentation because I had to like stop it and then have everybody get back on a few minutes later. However, suffering would be like a complete, like just completely catastrophizing it. I'm anxious. I'm an anxious person. Everyone has noticed this. And so everybody probably thinks I'm really stupid as a presenter. That is where maybe that's a conversion from pain to suffering. For whatever it's worth, another example, I wrote this before it snowed like 10 feet here in Colorado. But another example is like, oh, like it's snowing versus, oh no, like it's snowing. I'm going to be late to work. The roads are going to be really horrible. Um, so pain or acceptance doesn't mean that you like it. It doesn't like that you like feeling anxious or depressed. It doesn't mean that you approve of it either, but it's rather choosing to just be with it and not making efforts to resist it. In some sense, it's a choice. So that is to highlight what acceptance could look like. Um, okay, so I mentioned values and acts. So are goals a bad thing? Um, in treatment settings, whether in individual or in groups, or I'm sorry, I mean like treatment centers or one-on-one therapy, a lot of times goals are they come up in treatment. And I bring this up because being goals oriented is something that we want to be sometimes mindful about. goals Goals and values can go hand in hand. They very much do in act therapy. We just want to be mindful of getting totally reeled into a just a goals focused life approach. So what ACT really tries to do is highlight like, okay, what are some goals, but like why? Why is this important? Because that's what the intention is with ACT, is to get you back into a life that is of importance to you. And we're also not trying to get rid of anything that's happening for you either. We're just really trying to develop a different relationship between, someone struggles with anxiety or depression or trauma or whatever it is. We're trying to improve their relationship with those things, not trying to get rid of those things, because they're going to come up over and over again. So it's to improve the relationship with these symptoms so that you can get back to a life that's deep and personal to you. So I like to think of values as like a compass. So if someone values medicine, they might go to college to get into pre-med. Those are their goals. They become a doctor. That might be another goal, right? They have to go to pre-med. I'm not a doctor. I don't know what that all entails. This is just kind of like a general idea. And then just because they became a doctor doesn't mean that they then completed their value of medicine. They keep going. They serve their patients. They got to keep doing education requirements. Those are the goals that they do or complete along the way so that they can align their behaviors with their value of medicine. So it's just like a brief example. And yes, in ACT, we're trying to increase someone's psychological flexibility, but we are not in any way, shape, or form trying to make a perfect psychological, flexible robot. I have here as a question mark the turtle model. Um, it's very possible, it's actually very common, excuse me, that sometimes like those all those flexibilities that I showed you earlier, acceptance, diffusion skills, mindfulness, perspective taking, people are naturally just going to have like greater strengths in one area compared to another. Um, so the reason why it's called the turtle model, for whatever it's worth, is if you were to make a shape of those all together, it would make like a hexagon, right? And some people are just going to have greater strength. So if you just draw a circle like in one corner and then another corner, right? Some people are going to be like really great, say at like acceptance, like practicing acceptance, but maybe they're like not always the best with like mindfulness. That's okay. Because they might be really great at like mindfulness or, like I said, acceptance, and then they find a way to commit to action. So we're not trying to always make sure that it's always completely 100% perfect. We're just trying to help people help them get a little bit more flexible. Okay, so some things that you could do to possibly strengthen your psychological flexibility. Uh, Give your mind a name. Um, so this is a diffusion technique. Um, a lot of the times, like I guess we'll just go with the example that I had before, but like maybe I have the thought of like, oh, I'm so stupid. Well, sometimes when you're wearing that lens or when that thought is blinding you so much, it's hard to take notice. So part of diffusion is to help you take notice so that you can kind of separate that from yourself a little bit or not take it so seriously. So naming your mind, sometimes for myself, I'll name my mind Mr. Mind. And so if I notice a thought like, oh, I'm so stupid, that's not serving me, I might be like, oh, there's Mr. Mind. He's just going on. He's saying all these different things. And sometimes these approaches are a little bit more playful. And we're not making fun of the person at all when we do these diffusion techniques. We're just trying to not take your mind so seriously because your mind produces continuous stream of thoughts, and there's a very good chance that not every single one is going to be of service for you. So these are the types of techniques that you could do to help create some separation from yourself in your thought when you notice it's disturbing you. So also a diffusion technique is to just you could say it out loud, or if you want to say it in your mind, you could. Is just say, I'm noticing that I'm having the thought. I'm noticing that I'm having the thought that I'm stupid, versus just straight up saying I'm stupid. That helps create some separation there. Sometimes people will sing their thoughts out loud. Sometimes they do it to the theme of like happy birthday. Um, it feels counterintuitive, but a lot of the times they do that to some sort of like theme that they can really sing along to. And a lot of the times they end up laughing a little bit. And all that is just, again, not making fun of yourself, just, again, not taking your mind so literal. Um, Diffusion, that's another way to conceptualize it, is to deliteralize your thoughts. You could say one particular thought over and over and over again. Excuse me. So an example would be like, I'm stupid. So I've invited people to say like stupid, like just as fast and as loud as they can over and over and over and over again for like 60 seconds. And what ends up happening is that word like stupid starts to just sound a lot different. It starts to like not make sense. It just starts to sound like a sound. That is a diffusion technique. Again, another way of just separating yourself from your thoughts. Mindfulness is something that you could practice as well, including but not limited to mindfulness meditations. I share that because mindfulness is, like I said, just the practice of observing your thoughts, your sensations, your experience without any judgment. Um, but it doesn't always have to happen like in a meditation. Sometimes people can go for like a mindful walk, just notice like their surroundings, take notice of like, today, maybe like the cool air as it enters their lungs, not judging it in any way, just noticing it without any evaluation. So you could do something like that. A meditation, a lot of times, yes, does encompass mindfulness practices. It's just a structured framework. It's more of a formal practice. Some people like to do like to do it in a meditation. Some people don't. But you can still practice mindfulness, and it doesn't always necessarily have to be in a meditation. Such examples also include inside a meditation and out is just imagining your thoughts and putting them like on leaves on a stream and watching them go by, or clouds, or traffic. If you want to imagine like I-25 north and south, like maybe a bird's eye view, you're looking down and just placing your thoughts and watching them go by. Some cars or thoughts or clouds or leaves, some are going to go by slower or faster. It's just, again, creating separation between you and your thoughts. A few other examples here: screensaver, word art, clicking. Some people kind of are able to like imagine in their mind's eye putting their thoughts like on the computer. So you might be like surfing the web and like unwanted ads come up, and most of us just like click them out of the way. You could do the same thing in your mind's eye about your own thoughts, or you can put them on a screensaver and just take notice, as the word maybe bounces around on the computer screen, how it just changes colors. You could even get creative with it with like word art. Um, Again, just a way to not take that thought or word or whatever it is that you're hooked onto so much, not so seriously. And then you can always ask yourself too, okay, how's this thought serving me right now? It's a very mindfulness diffusion like question. A lot of the times people will ask them when they're noticing a thought like I'm stupid, and most of the time they'll just take notice, and that's all it is just taking notice like, yep, that's not serving me right now. I'm going to do something different. And the last one here is getting off your butts. So this is again, this is very much of an acceptance technique. And I spelled it on purposely like that, BUTS. So an example of this, I invite people sometimes to just replace the word but with and, so that they can get a different experience with it. So an example might be, I love my spouse, but sometimes we argue, or sometimes we fight. Um, I'd invite somebody to say, just replace that with the word and. I love my spouse, and sometimes we argue, sometimes we fight. Um, a lot of times, that approach feels a lot different, and as a way to practice some acceptance, um, so that both can be a reality without negating the other one. All right, so we're here towards the end. I'll have probably about 5 minutes to answer some questions here. But here's some contact information of me and Well Minded. These are some resources. These are a little bit more tailored towards therapists. These are just things that I've found that are helpful for therapists and non-therapists. These include some videos. A lot of this is like Stephen Hayes, an ACT deck, a workbook on OCD. Even though it says OCD, there's a lot of things that are probably applicable out of that, even if like someone isn't necessarily struggling with obsessive compulsive disorder. There's a lot of things you could draw a lot of flexibilities from that itself. Um, and we offer here at Well Minded, for whatever it's worth, some other services. Like I said, I offer the workshop. We have a DBT group. We're looking at developing other groups as well. And we have a variety of different clinicians who have expertise in both in treatment modalities and other mental health disorders as well. So thank you all for joining and being flexible with me. I know that went a little bit over, but I'll allow about 5 minutes of questions. And yeah, thank you so much for your time today. So I'll exit out of this. Let's see. Stop sharing. Uh, and does anyone have any questions? I'll even share my video. If you want to type them, you can. Thank you very much. Oh, sure. Yeah. Let me go back to that real quick. Thank you. Yeah. So let me share this. Um, the the let's see, I just want to reread skills. Yeah. So I'll show you those techniques. Okay. Let's go there. There we go. I also want to highlight just at the end, like these are like a very, very, very brief introduction to these. Um, Something that just might be worth noting is like if you try these out and they're not working, especially I would invite you to like follow up with a mental health professional, like within a therapy setting, just because um, sometimes a therapist then can kind of tailor these towards you a little bit more in a personal way. And that can help you internalize it too. So this is just like a brief introduction. Um, but if you're really curious and you're trying to like get a better grasp on these skills, I would definitely recommend like following up then with a mental health professional and either trying to consult with them or do that within clinical services as well. Okay, let's see. Regarding the mental health disorder diagnosis, I feel like I've received diagnosis that I like, just showed traits of which ultimately influence. I have this, so it's just the way I am. How does one who may suffer from this experience symptoms? That's a really good question. Um, so I'm gonna hold on, I'm gonna escape out of this just for a moment. It's kind of throwing me off reading it on here. No, stop the sharing. Yeah, so that's a really good question. So how I would respond to that is I would invite if there's a diagnosis, particularly when it's not an accurate one, I would invite being mindful of getting very attached to a diagnosis. So even when I'm working with my own clients, I might tell them like, hey, like technically you meet the criteria for this diagnosis, but I also want to be mindful of like not overly attaching to it. So maybe just for an example, and if you have questions like later, like feel free, you can email me and I'll let you know if like it feels like I'm able to answer it appropriately or not, or if maybe it's worth like a like referral to like services or like to consult with a provider maybe that you're working with specifically. But like an example of this would be like just like bipolar disorder, bipolar one, bipolar two. Um, there are a lot of like inflexibilities that come up with like bipolar disorder. And so what I try to do with clients is like I'd be like, yes, you meet the criteria for this diagnosis. This is a diagnosis uh, that you meet. However, I'd be mindful with attaching that as like an identity. That is something that I invite, regardless of their mental health disorder. I try working with clients and being mindful of not getting attached to that as an identity source. Because then what begins to happen for people is they attach to a diagnosis. It could be anything, it could be bipolar, it could be depression, it could be whatever. And that attachment there to the diagnosis, that becomes an inflexibility for people. So yeah, I I'm glad that's helpful. But yeah, so People can experience mental health disorders. I just invite all people to be mindful of how they attach themselves to that. Once they do that, then it starts becoming even a more inflexible experience for them. I got about like a minute or two left. Yeah, of course. You're welcome. I got about a minute or two left if anyone else has any questions. Yes, of course. Thank you all. Thank you again for joining me on a two-part Zoom today. Um, I'm going to be hopping off as well. So if you have any questions, feel free to email me. I think a lot of you got, obviously, I invited you via my email. So feel free if you ever have questions later. And thank you all for joining. Thank you.